And we'll go down. So we have no internet this morning, so we are going to do it the old-fashioned way. We're going to read off of our agendas here by paper. So Section 1 will, of course, be the opening of the meeting. Section 2 is approval of the agenda. 2.1, changes to agenda and approval of agenda. And we do have one change on the consent agenda, added item 8.34, employee benefit program renewal for the 2022 plan year. This item is considered an emergency due to a turnaround time required in order to comply with the open enrollment obligations established in the master contracts. And then Section 5.1, and appointment of specialist budgeting and financial services. So then we'll move down to Section 3, will be recognitions. We have none. Section 4 is visitors. We will have none. Section 5, again, administrative personnel appointments. 5.1, appointment of specialists, budgeting and financial services. 5.2 will be the appointment of assistant principal to 10-month Riverside Elementary School. Section 6, public comment. 6.1, members of the public desiring to address the school board. Form MIS 5241, public input and/or discussion of agenda items. And of course, we do not know until the night of the meeting. Section 7, committee and staff reports. And board members, just as we go down the consent agenda from here on down, just stop me if you have any questions regarding any of the items. 7.1 will be in-county travel, and 7.2 is out-of-county travel. So we'll move down to Section 8, consent agenda. 8.1 will be the approval of the consent agenda. 8.2, approval of the minutes of the workshop meeting of August 19th, 2021. Minutes of regular meeting of August 23rd, 2021. 8.3, appropriation of District 1 school board member capital outlay funds to Shalimar Elementary School for cafeteria tables in the amount of $13,326.36, presented by Dr. Lamar White. 8.4, appropriation of District 2 school board member capital outlay funds to Destin Elementary School for 4 smart boards in the amount of $13,436, presented by Ms. Marty Gardner. 8.5, appropriation of District 4 school board member capital outlay funds to Crestview High School for robotics team equipment in the amount of $2,724.82, presented by myself. 8.6, request to advertise a public hearing for adoption of revised school board policy 02-11, school internal funds. 8.7, superintendent's annual financial report and program cost report for year ended June 30th, 2021. And we do have all that there. Some good reading material there. Keep us busy. 8.8, teacher salary increase allocation plan, revised instructional salary schedules, and memorandum of agreement between the Okaloosa County School District and the Okaloosa County Education Association. 8.9, allocation of technician safety security, allocation for technician safety and security.
I'm sorry, can we go back to 8.8 when I have a comment on that, please?
Yes, ma'am. 8.8.
Okay, I just want to, if the public's watching this, the reason we're changing that is it's an effort to get our beginning teacher pay up to what the governor has wanted throughout the state. And just to show that each year we are getting closer and closer to reaching that mark, and that's why this change has occurred. That's correct, right? Yes, so, okay. Just want everybody to know that we are working diligently to try and get those salaries up. Thank you.
Thank you, Ms. Vanchek. So we'll move to 8.10, application for impact aid under PL 81-874 for the 2021-2022 school year, naming the authorized representative and core user account signer. 8.11, budget amendment number 11, fiscal year 2020 through 2021. 8.12, revised monthly financial statement for 2021, or for June 2021. 8.13, invoices to be approved for payment. 8.14, tag-on bid purchase over $25,000, Best Buy Education. 8.15, tag-on bid purchase over $25,000, Apple. 8.16, tag-on bid purchase over $25,000 train. 8.17, renewal of ITB 19-03, paper for offices and classrooms. 8.18, exempted purchase over $25,000 Scholastic. 8.19, service agreement number 22-58, Brent Purcell. 8.20, service agreement number 22-66, Brent Purcell. 8.21, service agreement number 22-70, Brent Purcell. 8.22, service agreement number 22-67, Matt Fossa. 8.23, service agreement number 22-68, Tim Van Dam. 8.24, service agreement number 22-69, Wayne Whitman. 8.25, surplus and salvage of school bus 00-4, 65-passenger International Thomas, VIN number 1HVBBAB91YH313096. And 8.26. Okay, now I got the giggles. So, all right. 8.26, surplus and donate one 1997 International Thomas 65 passenger school bus to Destin High School. 8.27, school affiliation agreement between the School Board of Okaloosa County, Florida, and the Hope Medical Clinic for the practical nursing program at the Okaloosa Technical College for 2021 through 2022 school year. 8.28, school affiliation agreement between School Board of Okaloosa County, Florida, and Rebecca L. Smith, OT LLC, for the practical nursing program at the Okaloosa Technical College. 8.29, PACT license agreement between School Board of Okaloosa County and the Home Builders Institute to provide services to students in the career and technical programs in Okaloosa County during the 2021-22 school year. And Mr. Chambers, I see Ms. Branscombe is in the audience. Ms. Branscombe, did you want to talk about this particular item? I know you always like to plug CTE when you can, so here's your moment.
So this agreement, license agreement, allows our carpentry and home building trade programs to have curriculum and online learning management system. So we have about 6 schools with it, and this year we were actually given 1 school free, but Long Beach High School is new this year, and so we were able to get, they gave us a free certification license for that school this year. We are looking to expand our trades program next year to 3 more schools, and hopefully next year we'll come back and have some more schools added to that license agreement. But that's where we are right now with that program.
Okay.
So
Thank you, Ms. Branscombe.
Remind me how many schools have carpentry programs?
So we have carpentry at Bruner, which
Uh-huh.
feeds into Fort Walton Beach High School, which is new this year.
Mhm.
Pryor that feeds into Choctaw.
Right.
And we have Crestview High School has the HVACs, which we're moving into the building trades. And those are the schools we have. And, of course, Baker and Laurel
Baker.
Hill as well.
Okay.
Next year, we're looking to add, we've had a lot of interest with Davidson Middle School, Shoal River Middle School, and Meigs Middle School.
Great.
So they're looking to start that program next year as well. And the students are earning certification. So there's 3 or 4 different certifications they have the opportunity to earn. So that's really good for our students because they can feed into the local economy and work.
Mhm.
And we hear every day from the builders that they need employees, just like everybody else. But trained employees will be good.
Great. Thank you.
All right.
Thanks.
As always, thank you for your work on CTE. So now we'll move to item 8.30, elementary and secondary school emergency relief ESSER 2 fund under the Coronavirus Response and Relief Supplemental Appropriations, CRRSA Act. 8.31, Title I, Part A, Florida Department of Education project application for 2021 through 2022. 8.32, Title I, Part D, Florida Department of Education project application for 2021 through 2022. 8.33, Title IX, Part A, Florida Department of Education project application for 2021 through 2022. And then finally, 8.34, Employee Benefit Program Renewal for the 2022 plan year, presented by Russ Frakes. And Mr. Frakes is in the audience today. Mr. Frakes, if you would, come up and tell us what all is going on here, sir.
Share the good news.
Share the good news.
Share the good news.
We do have some good news this year. Good morning.
Good morning.
The BALG Committee, the Benefits Oversight Group, of course, just to reset that, to let everyone know who that is. That's a group of, a committee, a standing committee that meets regularly to consider employee benefits changes, determine what to do in the coming year, comprised of representatives from the district, the CFO, Dr. Hale serves on that committee, as well as union representatives. Ms. Appleberg, I think, is here with us, so she's been involved in that. Angelique Cox and Patrick Strong as well. So the Benefits Oversight Group met yesterday morning. We considered the renewal, moved through it pretty quickly, fortunately, and had some good offers to consider. The biggest component of that, of course, is our medical insurance. We initially received an offer from United Healthcare to renew at 2%. They wanted us to, they provided a contingent offer for us to move our dental and vision coverage to them as well for 2% discount off over that. So they were going to give us a rate hold, essentially renewing at the same rate. We were able to go back to them, get that contingency removed. There was not, we considered, the Benefits Oversight Group considered making that move, moving that dental coverage to them. At the end of the day, the decision was made, let's just leave the coverage where it is, not get into that level of disruption, and we were able to get United Healthcare to remove that contingency, got the 0% renewal. So there is no increase this year on our medical insurance. That's great news for everybody, I know. So that saves, of course, the district money, but also the employees' money. They can count on that premium dollar being the same as it was in 21. So that's great news for everyone. The other components of our program were in multi-year rate guarantees. So we were in the last year of each of those for dental, vision, and long-term disability. So rate holds essentially there. So that's excellent news. The main component, we had an offer from Sun Life that provides our life insurance that was going to, their offer was a pretty substantial increase, over 46% increase on a retiree population, a retiree coverage. No impact on the active rate, so the employees and the district would not have paid any more, but the retirees would have had a substantial increase. We had, when FBMC was our broker, of course, that we're without a broker right now, we have that RFP going on, so you'll see more on that here very soon. But they were able to secure quotes from 3 other carriers, and so the Benefits Oversight Group reviewed and ultimately selected the Standard Insurance Company. They were our carrier before Sun Life, so they are familiar with Okaloosa County Schools. They also insure about 31 other school districts in the state of Florida, so they know this business. They understand the issues that we have. That was all driven by experience. We had about more than a 200% loss ratio in our life insurance, on that retiree sector of our life insurance policy. So for every dollar taken in premiums, Sun Life was paying out more than $2 in claims. So something needed to change there. The Standard understands that. They've got a plan and a vision in place for what will improve the overall health of our program. So we're excited to work with them, and so we will be bringing that new carrier in as a new carrier to replace Sun Life. A 5% increase on the basic coverage for the retirees. So that equates to where, and we've got that coverage split up now so that someone under age 70 for $25,000 in coverage was paying $17.80 last year. That means that equates to them a 94-cent increase there per month. And then on the folks over 70 that have $10,000 in coverage, theirs will go up 51 cents from $9.69 to $10.20. Still an excellent bargain. Better, it's going to beat anything that you're going to find from AARP or any of those other low-cost policies that are on the market. So we're still offering a good value to those retirees, but it's going to help improve the overall program in the long run. So that's really where we are at this point. And of course, we have our HRA and FSA programs that we'll renew. We've renewed with Lockard and Williams, as we have every year. They've always said Kenny Anderson is great, does an excellent job servicing our employees, making sure that they have that HRA money that the board provides, and the FSA money that the employees can elect to have come out of their pay to help pay for medical, dental, vision costs. That program works very well, and Kenny has always said, as long as Okaloosa County remains with Lockard and Williams, now 90 Degree Benefits, that's not going to change. That their cost to administer that program is not going to change. So we are still holding steady with that one as well. So great news all the way around, zeros all the way down. So that always looks good. First time we've seen that. Just a slight increase on the retiree. So the news for the district and the active employees is no increase for their insurance benefits this year. Any
And,
questions at this point?
Yes, I do,
ahead,
Mr.
Dr.
Bright. I've heard you mention broker a
Yes.
couple of times
Yes,
this
sir.
morning, and would you say that the broker services were helpful in these negotiations?
Well, we've been without a broker since the beginning of August, so we were able to get that done ourselves, and so it was. We have a good relationship. We have an excellent relationship with all of our our carriers, our insurance carriers. So I'm able to make those phone calls and speak with folks. Spoke with the vice president at United Healthcare, and he wants us to move that dental coverage to us. He told me that. He said, let the BOG folks know, and he would certainly say to the same to the board. They want to be in business with Okaloosa County School District. They enjoy this relationship, and matter of fact, he's going to come up here and is promising me to come up here and visit and see the folks on the benefits oversight group, and maybe I can even drag him to a board meeting to speak with you folks as well.
Well,
But
in
we
this
have a good
case-
relationship with those folks, so we were able to get that done.
Right. Well, in this
on our own.
case, I commend you on your negotiation skills.
Well, I should say, I can't take credit for that. I should also share with you some of the good news, and there is a reason behind that excellent renewal that we saw from United Healthcare, and that praise should go to all of our employees,
Okay.
because we've seen the impact of some of the efforts that we've made, some of the promotional things that we've done, some of the things that United Healthcare has done, the message that we're delivering to our employees. Of course, for years we've had issues in our area with ER visits that have just been, heavy usage of our ERs, and that's the more expensive methods of consuming health care. So we've improved on that dramatically. So we've seen more than a 16% decrease in ER visits, 18% increase in urgent care visits, a much better, much more economically feasible way to be seen by a doctor, and an 81% increase in virtual visits. That's telemedicine. So those folks are that proof of concept that was kind of shown during COVID when it was necessary, when that was sometimes the only way you had to see your doctor. That convenience factor is, I think, weighing on and folks are realizing, hey, this is a pretty good deal. I'm going to go ahead and pay the $40, and during COVID they actually waived that fee. But this is a measurement period that's comparing to the 2020 year when it was definitely impacted by COVID. So even now we're increasing 81% even over those numbers. So that's excellent news. So it's not without reason that United Healthcare was able to give us that deal. So I was able to take those numbers back, and so we had the numbers to support the argument that we need a rate hold here. Wellness exam, breast cancer screenings, cervical cancer screenings, all up. Catastrophic cases, so those cases over $50,000, catastrophic cases per thousand, and average paid per claimant all down over 10%. So excellent news there. So it was not unwarranted that we had that rate hold. So
And so I understand that those metrics really helped
yes, absolutely.
your negotiation.
And they do, and there's a reason behind them. We have to stay vigilant in delivering that message to our
That's right.
employees so that they know we can't let off the gas here. We have to continue to
Yep,
push
yep.
those issues and understand that there are better ways to consume health care. We have to take advantage of those. The United Healthcare does an excellent job of providing us with the tools. Our employees have to reach out and take advantage of it. We're starting to get a little momentum there. So it's excellent news. It's very encouraging
Yeah.
to see those
Well, good job,
starting to
Mr.
turn the
Fritz.
corner on
Good
that.
job.
All
Thank
right.
you.
Anything else? Any other?
So, a
Yes.
couple of
Go
follow-up.
ahead.
Go ahead. So, the direct answer to Dr. White's question of, is the broker necessary? I'm hearing you say maybe not.
Well, don't want to get ahead of
afraid that was
myself
coming
there.
after you.
I'm not going to say they do not play a vital role.
Answer.
We,
Maybe
out
you
of
can be the
necessity,
broker.
we have, and it's not. We're looking at going into open enrollment without a broker, and that's one of the reasons that. And I called Mr. Bryan and asked, can we please get this in here? Everything kind of, like I said, we just had the BOG meeting. This was just decided
Right.
yesterday morning, so. This saves us, being able to get in this meeting is going to save us 10 days of processing time, which is going to be very, very important on the backside of open enrollment. Of course, we're obligated to have that 30-day open enrollment by the master contract. We have to meet that for our employees. We have to make sure that we communicate that message and have the opportunity to talk about things like Dr. White, we've seen be impactful
Okay,
during this renewal cycle. So
Thank you.
I say the broker does play a vital role. If we get the right broker in, I'm confident that we will. We're going to have that meeting again next week, so we'll be bringing some of that information to the board here very soon.
Okay.
So to hear about that, and I think we'll have somebody in place that'll be able to provide and have a positive impact on this district and its employees.
Okay, my second question
Yes.
then. I love the fact that no, the rates had gone up, and there were zeros in a lot of the
Yes.
columns with the fact that the co-pays were static as well.
Yes, that's
But there
correct.
was one pending, and that was the dental. Do you have
Yeah,
any
no, it should have
feeling
been,
for how
it
that's
could have been a
going?
version issue. There were a couple of versions of those
Okay.
because of the way that we
Oh,
did that
so
meeting. So
something
it
in
would,
there.
it was, yes,
that would be 0 as
0%.
well. Okay,
Correct.
super.
Correct. That's
Thank you.
correct.
Ms. Vancheck?
Wow, what a turnaround in a year.
No,
That
right.
you
That's correct.
came, and as you know, you and I talked.
Yes.
I wasn't happy.
I know.
And you were very, very kind and professional, and because it was troubling me that the
Right.
years before,
Absolutely.
every year on the board was going up double
Right.
digits
Yes.
from the year before. So thank you and the BOG so much for hearing the pleas. I know you wanted to do it anyway, but maybe a little voice from this side helped kind of spur that on.
Yes,
and
ma'am.
and then, of course, you brought in your broker at that time, and
Right.
that was less than impressive. And then I brought you back in the spring
Yes, ma'am.
and pushed you again. So thank you so much for,
Yes.
I know you were already doing a good job, but sometimes things need to go. But this is great news for not only our district, but for our employees
Right.
who have had to, go through so much. So again, I appreciate all the hard work. I know this
Yes,
took
ma'am.
many, many meetings.
It does.
And
It
a
does.
lot of things that all
It
through the
does.
time,
The-
because
the-
I've stayed up with you and know that you've been meeting. So again, I appreciate that, and I appreciate you taking my phone calls and
Absolutely.
listening to
Happy
my
to do it.
concerns. Thank
Yes,
you.
ma'am. The Benefits Oversight Group has rolled their sleeves up and is really looking, and that's not ending. That will continue. That will continue anew when we have that new broker come in and really dig into, continue to look at these problems and maybe see some fresh ideas and have new things to talk about and new things to bring to the board. So we're excited for what the future holds for us.
And if this board approves
It's gonna
that
be
plan
positive.
Monday night, when will it go out to the employees?
When will our open enrollment begin? Is
Mhm.
that what you're asking?
Yes.
Prospectively, on October 11th, we're looking at starting
Okay.
open enrollment. We'll run it through November 9th. We're doing all those things. We're working on finding folks to print our books and
Mhm.
things like that, do all those things that have to fall into place. There's a lot of things that happen behind the scenes.
Right.
And we've got a plan in place for all of those to make sure all of those move forward smoothly. We'll do open enrollment a little bit differently this year. We had to get away out of necessity from our in-person meetings last year, although we did a few, I'll go to a faculty meeting and speak sometimes to just a 5-minute quick reminder and hit on some high points. But we're going to be doing some more electronic stuff. Really, that old model of going out and doing the meetings was becoming less and less effective. We were seeing attendance of those meetings less than we were going out 15 meetings and seeing less than 300 people. Really wasn't an efficient way of delivering that message. We were, carriers, United Healthcare was bringing a person in, and some of the other carriers were bringing, the brokers had people there. It was a big dog and pony show that we were taking all around the county. But the desire on the part of the employee is not there to go and sit in an hour-and-a-half meeting. They want the information, the pointed information that they want to get the answer to, and that's where we're going to go. And that's the model we're going to adapt to. Just really what's delivered in a different method that's a little more economically feasible and really what the consumer wanting, what the employees are wanting. They're not wanting to go sit in an hour and 15-minute meeting.
Will they
anymore.
still electronically
Yes,
sign
correct.
up?
Yes, ma'am. We'll have the same platform available.
Mhm.
They'll be able to go in and make their elections.
Is that the only way, or do we make
They can do, well,
accommodations
we're going to
for-
have the matter of fact, we've got conversation ongoing now. There'll be a call center that will get activated again this year. It worked very well last year. We've done some different things with call centers, and some have been less effective than others. FBMC provided us with their own call center. Wasn't very effective, frankly. We've got Web Benefits Design as the provider through which we enroll. They have a call center, so they're obviously able to get into that system where Web Benefits call center folks couldn't. So it was really kind of a frustrating process for the end user, for that employee that was having trouble getting logged in because that person really couldn't help them. The Web Benefits call center is much more effective. It worked much better last year. And we're going to look at bringing those back. We're having conversations with them now to bring that. I anticipate that we'll have that available again as well. So an employee can enroll online. They can also just call an 800 number and speak with a representative at Web Benefits, and they will take them through it just over the phone. They can call somebody at Risk Management. We've got folks that still do that, and we're happy to do that. We've got the folks there. The ladies in my office do an excellent job. They know a lot of these employees that call annually, and get that extra helping hand, have some questions about what exactly they need to do. So there'll be multiple avenues for an employee to get engaged and consider what they need to do for the 22 year.
Yeah, but there's no more lines out the insurance office?
No, that's
otherwise.
not been the case for several
Yeah,
years. So
good,
we're
great.
doing pretty well there.
Okay.
Harnessing some of that technology that's been made available to us.
Great, thank you.
Well, and Ms. Vanchek, excuse me, mentioned how excited our employees are going to be, but also our retirees.
Yes.
Who have been loyal to this district for 20, 30, 35
Yes,
plus
ma'am.
years.
Right.
And with everything in our country that's gone up quite a bit, it's nice to hear that the one
Yes.
thing, insurance.
Yes, ma'am.
is that big zero increase. So
Absolutely, yes.
Thank you for all your hard work.
It's a
and-
substantial expense when you're looking at, if you got we have retirees that come to work for us a lot of times very early in their careers and stay with us their entire career, very many of them. And they've got some time to, that gap to bridge between when Medicare eligibility and retirement and the expense that they're looking at with regard to funding health care is substantial. It's quickly approaching mortgage, territory. When you're talking about a husband and wife having to carry coverage, continue coverage for a few years until they hit that 65 age and can get that discounted for health care. So it's good to be able to at least put the brakes on that for now anyway, and we'll hope if we can stay vigilant with our employees and them doing the things that we've seen, that we can at least slow that. And again, the BOG is going to continue to working with our new brokers and continue that success future.
Well, I just
Very
want
good.
to say, thank you for setting the bar for our new broker, should there be one.
Yeah, yeah.
Yes. Yeah, we'll see that very
Exactly.
soon. Anything else?
That-
Thank you.
I'll
Thank
just,
you, Russ.
real quick, Russ, before you walk off, I just want to say thank you for all that you do. And I know we work together on a lot of different
Yes,
things
sir.
from FISBIT to here.
Yes.
But I just appreciate all the work. And Mr. Chambers, I appreciate the support that you're giving risk management, because obviously we're starting to see the payoff.
we are.
When we
Absolutely.
focus on preventive things
Yes.
instead of being
Absolutely.
reactive.
That's where we wanna be.
So thank you
Absolutely.
very much. Thank you, Russ.
Yes, sir.
Okay, good. Nice job. Yeah, good news. Yeah.
All right, so now we'll move to Section 9, and this is the Superintendent's Human Resources Recommendations. 9.1 and 9.2 will be informational only on Monday night. 9.1 is employees on administrative leave. 9.2, deferred retirement option program. 9.3, forgiveness of workday for employees due to Hurricane Ida, August 30th, 2021. 9.4, cleared certification requirements and issuance of contracts for the 2021 through 2022 school year. 9.5, out-of-field report for the 2021 through 2022 school year. 9.6, employment separations. 9.7, personnel recommendations. 9.8, employee transfers. 9.9, employee reemployment. 9.10, reinstatement reimbursement of sick leave due to line of duty illness, injury, medical examination. 9.11, leave without pay. And then Section 10 is discussion agenda. Item 10.1, items moved from consent agenda. At this time, we have none. And then one of my favorite parts of the meeting, Section 11, construction program owners representatives business. And Dr. Kelly, I'll turn it over to you.
Okay, and we will meet bright and early Monday morning, and I will be able to give you the September report at Monday night's meeting.
All right. Thank you very much. And we do have one action item, 11.2, program number 6, task order number 14, GMP and owner direct purchase ODP for Fort Walton Beach High School Boys Field House Roof Project. And then section 12, we have no business there. Section 13, Mr. McInnes?
No report this morning.
All right. And section 14, 14.1, out-of-state student trip request. And then 14.2, Mr. Chambers, I will turn it over to you, sir.
Thank you, Mr. Bryant, and school board members. I do want to give a few updates today. I want to start with Hurricane Ida. And as we know, we had a discussion previously about displaced students. I do want to share with you that the impact to Okaloosa schools of displaced students due to Hurricane Ida has been very minimal. Okay? Also want to give a curriculum update. As you know, the last time we spoke, we shared that we are going into kind of a testing season, and that testing season being iReady. So this week, those tests will be complete, and now schools will go through the process of really looking at that data and then tailoring instruction to help meet those individual needs of students. And I know last year, Dr. Kelly, you were appropriately looking at this type of testing because we know that there was learning loss. We kind of flipped that to, hey, we want to accelerate the learning. Your approval in iReady is a big deal for this school district to help our teachers, to help our students. So very much appreciate each and every one of you for that. But now the work truly begins of looking at the data and then making the appropriate instructional decisions. So I want to give you that update. Enrollment is something that we've been talking about here at this board, and our numbers have fluctuated. So currently, we are at 29,967 enrolled students, and our October projection is 30,363. So right now, we're approximately 396 below that mark. What we know right now is we have I'd say a substantial increase in Okaloosa Online. Give you some of those numbers. We have about 485 students in Okaloosa Online right now, 485. This is compared to in 2019 again. In 2019, we had 266 students in Okaloosa Online. In 2020, we had 228 students in Okaloosa Online. So we know right now that some families have chosen Okaloosa Online as a model. As a reminder, last school year we had My School Online, and as we know that was a state adopted program that was there. That was there for families, that was there for all 67 school districts. That option is not there this school year. Thankfully, we do have Okaloosa Online. As we talked last time, that funding is different. However, the increase in Okaloosa Online in terms of our projection is up there. So that will be a good thing. I will say, Mr. Horton, as you go back, as we have always done, we've been very conservative with our allocations. So going back to the spring, but also even being conservative now with where we are as he looks at high schools, for example, and if some of those numbers are low, substantially low at a high school, there's been some combining of classes, so eliminating a section. So we've looked at that as well. So just wanted to give you that update. We're very mindful on that. We've also, in our ESSER 3, which we're hoping that will come from the state here shortly, we're hoping. They've given all assurances that will come and that ESSER 3 funds will be divvied out to all 67 school districts. But in there, per the Commissioner of Education, we've put in there a line item for being short in FTE due to this pandemic. So we have that ready to go as well. As you know, class size dollars were cut, so that's an impact. But again, looking at ESSER 3, that's we will be very happy to receive those dollars. This is American Founders Month, so we're excited about that. I want to give you just a little bit of updates. Lessons and activities are planned for classes. Mrs. Flanagan has sent that information out to all schools. So our social studies teachers throughout the district will be doing different activities over the course of this month. And of course, many of them do their own activities as well. Additionally, Constitution Day is September 17th. And this is going to be a day where students are going to learn about the Constitution and the importance of this document to our nation's history and the freedoms we appreciate each day. So that's kind of the highlight, the theme of that day. Also celebrate Freedom Week, which begins September 20th. Students are going to recite the preamble of the Constitution. Teachers are going to integrate resources. Students will learn about the Declaration of Independence and the importance of the founding of our nation. So that's kind of the theme there. And then, of course, this Saturday is Patriots Day. And all schools are going to observe a moment of reflection tomorrow. But there will be a number of things that they'll do, and I'm just going to share with you what the schools will be saying in their morning announcements tomorrow. And it says, today in our schools, one day before the 20th anniversary of the terrorist attack that occurred against our nation on 9/11, we take a moment to pause in solemn remembrance of those whose lives were lost that day, in unwavering support of the families who lost loved ones during the attack on our nation, in utmost respect of the heroic first responders who risked everything on that day, and in the patriotic appreciation of the brave men and women of our military who keep our nation safe each and every day. So across our district tomorrow, it will be at different times. If 9/11 was on a school day, we would all do it at the same time, but that will occur on Saturday in terms of how people remember that day. But this is what will occur in our schools tomorrow. Any questions to this point?
Yes, I want to go back to something on Hurricane Ida, if you don't mind, sir. Could you just remind the public how you come to a decision, and actually it's not your decision, when we close schools on an event like a weather event?
Absolutely.
What that
So-
process is, please.
Absolutely. Myself and Mr. Horton, once we understand that there's the potential for hurricane, tropical storm, severe weather to be in this area, we immediately get on the phone with Patrick Maddox, who's over the safety and weather emergency management for Okaloosa County. So it's true that there are reports that are sent out to all agencies, but we do not go by just the simple report that is sent out. We get on the phone with Mr. Maddox. So for example, leading up to this last hurricane, Hurricane Ida, where we suspended school on that Monday, Saturday on the phone with Mr. Maddox after each and every update, getting briefed. Then myself and Mr. Horton then have conversations based on the very specific information that Mr. Maddox gives us. Then we get to Sunday, where specifically are we? Has anything changed? Yes. So therefore, we start having conversations at that time as well. Our goal is to get out information, if it always seems to happen on a weekend. Our goal is to get out information on that Sunday around noon. But sometimes the hurricane does not cooperate with us to get it out around noon. So therefore, we have conversations with Mr. Maddox again after that 4 o'clock briefing. There's usually a morning briefing, and then there's another one, and then there's an afternoon briefing, and then there's another one. So after that second briefing, sometimes that's when a final decision is made. That's the last accurate information. And when Patrick Maddox might say to me, I cannot rule out high gusts of winds in the 40, 50 mile an hour range, and that we know that buses cannot be on the road over a certain mile per hour, and 40 miles an hour is past that range, then we have to start making decisions. He does give us recommendations on what we do. We take those recommendations into account, then talk with Mr. Horton, and then we make a decision for the school district. As it pertains to the Tuesday, where we ended up having some negative weather on that day, we also spoke with emergency management about Tuesday and to make a decision on the upcoming school day. So we got all of that information as well. So the weather that occurred on Tuesday wasn't necessarily part of that briefing. And again, weather can be unpredictable at times, but we go through exhaustive conversations with Patrick Maddox, who's the head of the emergency management of this school district, and then make decisions.
I think it should also be said that you have to make a decision for all of this county. And while weather might be different in the north end than in the south or the central zone, and we get complaints from that area that had the weather, where the other areas are quite glad that they were able to go to school. And also, having served in all 3 zones in this county, it is true that we have a zone with a lot of creeks and a lot of rivers that swell. And you have to make a decision for all of those children, and we can't close just a portion of the county to make one portion whole. We have to make decisions for the entire county. So I think all of those components being considered, we've done the best that we can.
Yes, ma'am.
Thank you.
No, thank you for that, because, people have varying opinions when we close the schools, but I just wanted to make sure, when people say superintendent closed the schools. However, that's not exactly accurate. I mean, of course, but I wanted to make sure that that was out to the public and how that process happens. Unfortunately, you nor Mr. Horton has a crystal ball Tuesday morning. I mean, you went with the information that you were given. And also, people need to understand that when you're trying to move or get 29,967 students plus about 3,000 employees to work, it's a bigger picture than maybe the person who is still working at a business locally that they can get there and so forth. So you have to look at that kind of big picture of moving a lot of students and doing it in a quick time of calling that. So thank you for letting us know how that's happened and for your diligence on that.
Yes, ma'am. And I also would say that I thank Patrick Maddox because he takes each and every one of my calls. And bless his heart, I don't think they sleep literally during the hurricane time. I don't think they sleep at night because they're constantly getting updates as well. So I appreciate that and appreciate that question.
And
Well-
today does mark exactly the midpoint of hurricane season. So we
Yay.
have
Yes.
half
Well,
left
and
to
if,
go.
and if I can just interject real quick, Mr. Chambers, and what Ms. Vancheck was saying, I know personally because you called me on Sunday before you made the decision, and I can tell everybody that's listening, it's a huge burden on Mr. Chambers' shoulders to have to make a decision like that. But in the whole scope of it all, it's better to make those decisions that are going to be in the best interest of our students and safety. And I know on that night, it was weighing heavily on you on which direction to go. But in the end, I think, that was the right decision to do. And, I appreciate the fact that you listen to all those people that are advising you and you make the decision that you think is going to be in the best interest, like Mr. Vancheck said, and Dr. Kelly said, for the whole county. So thank you very much.
Safety being the priority on
Yes.
this decision.
Yes.
And that's right. And sometimes we know in the past, long ago, I remember, some of you remember, we've had to make those kind of decisions, and the next day the sun was shining.
That's right.
And I would just say, and I appreciate Superintendent having what that means to have to make these calls. And I just appreciate you erring if there's an error on the side of safety.
Absolutely.
Yes, sir.
Always.
Absolutely.
Thank you.
Okay.
I want to give an update on COVID. I do want to share just a couple of pieces and then go through some very specific items as well. So, as you know, this has been an interesting start to the school year. We talked about, in essence, 2 hurricanes. We've talked about isolation and quarantining of employees. We have critical positions that are hard to fill, just like other counties and across the state and even in personal businesses. So this has been and I'll even say it's been a tough start to this school year. And what our employees have done in the midst of this, I say again, is nothing less than remarkable. But I do want to let you know, each day, one of the first things that we do when we get to work is we look at those COVID numbers. We have discussions about them. We contact schools and share thoughts, how are certain things going. So we're paying very clear attention to the data. Also, I think it's important to know that we also speak with principals. So when we start looking at where are we in our protocols, so I pulled together a group of principals and shared that here are some of the protocols that we're considering implementing as we add additional protocols. So we run that also through, which I'd call an advisory group. We talk through it. What is the impact? Let's make the best decision for the safety of our students and employees. Also, on a daily basis, numbers come in and they're disaggregated. They're sent out to the schools, and then the schools now have their lists. They then start contact tracing. Families are notified. So this is happening every day. At every school in Okaloosa County, there's a COVID administrator, and that administrator who used to maybe work on maintenance and facilities, who used to maybe focus specifically on curriculum and instruction, They do not focus on that at all right now. Their main focus each and every day from start to finish is COVID. And that's what they are doing each day. Most schools, there's also front office staff and maybe another person who's helping as well. At the end of the day, at most schools, the administrators then divvy up those calls, make sure that we get clear communication with families and timely communication with families. And many times there's also some teachers or even ed support who help. So just want to kind of give just a little bit of a flavor there. I do want to say on the good news this week, we've seen a little bit of a tick down, which is I'll take as positive. Last week, Sunday through Wednesday, there were approximately 283 positive cases. This week, Sunday through Wednesday, there's approximately 157 positive cases, which is about 126 cases lower. I was talking with the surrounding superintendent, and they've noticed that their numbers have also dipped some this week. Hoping very much that this trend continues. I do want to just back up and share this also some information about COVID. As you remember, last year we had 1,907 positive cases in Okaloosa County, in our school district, that is. Of those 1,907 cases, that equated to 10,871 quarantined individuals. Of those 10,871 quarantined individuals, approximately 1.3% of those individuals ended up becoming positive. I'd love to see 0%, but 1.3% is the factual data, and this data comes from the Department of Health. Also, last year, notification of positive 19 cases from the Department of Health due to no fault of their own lagged last year. So as a result, on average, individuals were notified to quarantine 6 days from their date of last exposure to a positive case. So we were 6 days in when the schools were notified of the positive case, and then we started contact tracing. So then the question is kind of, where are we this year? Okay, where are we this year? Now, it is true that the numbers this year are more than the numbers last year, so a little bit of data. And again, this data comes from the Department of Health. We've had, through September 7th, we've had 1,250 confirmed positive cases, which is about 4.09% of our population, 4.09%. We've had 7,463 quarantines, 7,463 quarantines. The transmission rate, so those who become positive at school, is 1.97%. 1.97%. Again, I'd love to see 0%. So how do we come up with the 1.97%? So we take all of the positive cases that come from the Department of Health. Then we look at who are now contacts. Who are contacts? So if you're a contact, if all of you are a contact, we now look at that date stamp going all the way back to the beginning of the year. And then if any of you become positive, we assume that that happened in the schools. So we're taking that assumption that that happened in the schools. And so 147 individuals this year, after being a contact, have become positive. So that's 1.97%.
So real quick, I mean, you said a key word there. The assumption is that they've got, that it could have happened in school,
Correct.
but not necessarily though.
So we do not know that
Right.
factually, and we're just going on the side of caution, so to speak, and just, we're assuming that this has happened at school. And again, I'd love to have zero transmission at all, but those are the numbers, again, that we get from the Department of Health. However, I do want to share, some of the protocols, okay? So protocols that we've had in place this year, and this is a highlight of them. So we've had cleaning and disinfecting classrooms and frequently touched areas, cleaning and disinfecting of classrooms and frequently touched areas. That's been going on. We've provided hand sanitizer in classrooms and on buses and in common areas. We've adhered to the contact tracing and quarantine rules. We've suspended indoor large group gatherings. We've limited individuals who may enter the school buildings. We've emphasized consistent and proper hand washing. We've recommended masks, and we've provided the opportunity for students who would like, or instructors who would like, to have desk barriers as well. On this upcoming Monday, you're going to see these additional measures that are going to go in place. And again, this is a highlight of them. Some of these additional measures. We're going to be monitoring and directing student movement in hallways and between classes to minimize contact. So as you know, at the elementary level, it's you're going on one side, you're going on the other. The secondary level, those students don't necessarily comply like they do in elementary. So we will have administrators and teachers at doors like they already do, and we're ensuring that kids are not congregating, clumping up. We want to get them into the class. Also, we're going to be replacing AC filters more frequently. We're strongly recommending masks. We're ensuring student use of hand sanitizer upon entering and exiting school buses. So when they get on or off, there's hand sanitizer there. We're going to say take the squirt of the hand sanitizer when you get on, take the squirt of the hand sanitizer when you get off. We're scheduling set times for hand washing. So at the elementary level, we've talked with our principals as of yesterday. We had a meeting with all of them. At the elementary level, there'll be schools will establish scheduled hand washing times. So this might look like there's in the morning, there's before lunch, there's after lunch, then there's the afternoon. But schools will schedule those hand washing opportunities. We're going to increase the space between students during meal times. So at the secondary level, some have the ability to eat outside, so they'll be spacing out lunchrooms. Some schools, even at the secondary level, have added an additional wave of a lunch to thin it out. Not all schools have the ability to do that. And then where they can't eat outside, schools are working on spacing out the lunchrooms. Also, during mealtime, we're increasing the space between students in line as well, so we're trying to be mindful of that. You'll see disinfecting desks and tables between classes, so we're going back to that from last year. So between each class at the secondary level, teachers could be in an aide, and also at the secondary level, it could be a student who grabs the hand sanitation wipe. We wipe down the desks and the tables, and at the elementary level, it would happen more between maybe ELA and math, or if they're departmentalized, when the next ELA classroom comes in. We're suspending the use of water fountains. Now, water fountains, we've ordered and installed many of the water bottle water fountains. Many of those have already been in use. Schools have already been mindful of water fountains, but we've just suspended the use of water fountains right now. But we've shared with schools that every student in Okaloosa County is about to receive a water bottle, thanks to Fishbein, which we absolutely appreciate. But schools also, we've shared with them to allow students to bring their own water bottles as well. So there'll be water availability in all the schools still, but we're using water bottles.
Mr. Chambers, real quick, you mentioned the water filling stations, and from what I gather, not every school has them. The schools that don't have them, how are they going to be able to allow the students to fill their water bottles up?
So each school will establish the water fountains that will still be in use for the water bottles. Many have also sinks in the classrooms as well, where they'll be able to utilize that. But the communication method from the schools to the students is that we're not putting our mouths on the water fountains. Many water fountains, as you all travel to schools, you're going to see are going to be, the school will not have some of them in operation, and then some will be in operation as well for the water bottles. Okay? And then you'll also see at the elementary level, we've talked with the schools about keeping students in cohorts. So for example, in the classroom, you all might be at a table, so that's your cohort. Now as you travel to lunch, that's the group that you sit with. As you're in line, that's the group that you travel with. So we're looking at cohorts additionally. And then as added measures as well, we've started a testing site here at the Central Complex for those individuals who have symptoms. And I want all of us to understand it's for those individuals who have symptoms. So if they think that they might be COVID positive, they have the ability to come here and get that, that prognosis. So they might come here, yep, I'm positive, or they could get a negative. If it's a negative, then it's sent off to a PCR to be able to be analyzed. Right now, per the Department of Health, this testing site does not allow for a negative result to then come back to school early. They don't have that test right now available. So that's the test that we've pushed for, to be able to have a negative to come back early. I can't create tests. So that's what we have right now. As soon as we get the tests which allow for a negative to come back, we're going to add that to this testing site. The other piece that we've tried to go above and beyond for our employees and our students is vaccination sites for those who choose voluntarily to be vaccinated. So at the secondary level, starting in the, I believe it's the third week in September, it's all out there. Families, in terms of their students, and employees have the ability to get vaccinated. There's a vaccination date in September, and then there's also one for the second shot in October. So there's a lot that we are doing for COVID. We're very mindful of it. It's something that drives the majority of what we do each day, and rightfully so, because this is real, and we're taking this very seriously. So I have one more topic, but pause for questions.
I do have one question regarding some of the protocols that we have in place. Now, all of these protocols are for school, during school normal hours, correct?
Correct.
So the large indoor gatherings, explain what items those might be.
So large indoor gatherings could be a pep rally. It could be grade level assemblies. We still are being, even after school, large gatherings in the school building is something that we're not doing right now. So schools, pep rallies, for example, we've given them the ability that they can do a pep rally, but it's going to be after school, it's going to be outside, and you have the ability to schedule those. So some of our high schools are happy to be able to do those for the students. We've also told them, even in the outside, to be mindful of the social distancing as well.
I have a question. And Mr. Chambers, you and your team, our principals, our teachers, employees have done a remarkable job, and as you said, during this tough time. And I'm sure many of you board members are receiving the emails about the governor and the mask mandate, the appeal, and I don't know if Mr. McGinnis, and I'm sorry, I'm putting you on the spot right there, if you'll kind of share where we are at this point, because I know I'm receiving emails, individuals, think because the judge ruled against the mask mandate, they don't really quite understand, so maybe just take a second and share where the district is standing right now.
Yeah,
all of the districts.
The circuit judge ruled against the mandate. The governor's appealed that, and from our standpoint, though, as a school district, we're not under any other directive at this point. The decisions are still being made here
Exactly.
locally, and so what's happened there is not put us under any kind of court order or directive to change what happens here. So the decisions are still being made here locally in regard to these protocols.
There just seems to be a lot of confusion out there because of what's being read in the paper and about the mask mandate. So, but again, your team is, I can't imagine as principals, and again, this being a priority to start our day, it's a shame that it is a priority, but you and your team and everyone's doing a remarkable job, so thank
And I
you.
would add one thing to that, Ms. Gardner. What was shared with superintendents is, like Mr. McGinnis said, what was shared with us is that the governor is going to appeal and that this will make its way to the Florida Supreme Court. So this is still going to be going on for a while.
Well,
And that's kind of what I'm sharing also, but it just, to kind of clarify it out there for everybody, because again, receiving the emails that,
Well, and correct me if I'm wrong, there's also the parental rights deal out there that clearly gives the parents the parental rights.
Yeah, so that legislation was adopted and is in effect. And so that, that does have a bearing on some of these decisions. But once again, we're not under a court order of any kind right now to do or not do these protocols. That ability is still available for the local jurisdiction.
All right.
I have a question about contact tracers. I believe we approved to have some more hired. What's our status on that, please, sir?
So I believe we've been able to hire 7. So the, is it Health Heroes? So Health Heroes, nope, it's on Aviana. So Aviana, you gave us the ability to hire 20. So far, we've been able to get 7 as of my last update. But through Aviana, they have to go through a 2-week background check, training, and all those things, and then we have to train them on contact tracing. So I believe next week we should be with the ability of the 7 new folks to get out there and give some schools some relief. Of the 7, they're not all full-time. We said we'll take part-time right now as well. So what we will do until we get the full 20 is we will look at where some hot spots might be, for example, and send them over in those areas to be able to help those administrators, whether it's contact tracing, whether it's filling in the information, whether it's contacting the families, to be a relief for those schools who are doing the contact tracing.
And one other thing, last year, we looked at some modified block scheduling to keep, so students wouldn't have so much movement, particularly secondary. I know we're hoping that things go down so we don't have to do that, but is that still kind of on the side to maybe look at that?
I will say it's on the side right now.
Yeah, but it's out there, so, but hopefully we don't have to go to that, because you're talking about movement in the hallways and everything, and that, when you have block scheduling, you don't have to move
As
so
many
many
times.
periods, yeah, so, all right, thank you.
Well, I just have a comment, some
Yes, sir.
information to share, and I know we all hope and pray that this is true, but this morning, there was a media report that in the case of 3 states, Florida being one of them, there appears to be a reduction in the infection rate.
Great.
And so we just have to hope and pray that that continues and that's the case here in our schools.
Thank you, Dr.
Well,
Moore.
just about the time I think, I know you go through a lengthy list of everything that's being done, just about the time I think, okay, they could not think of anything else to do, you come back the next time we meet with another list of safety precautions. So you, again, your team, your leadership, remarkable job, so thank you.
Thank you. And the last thing I would want to say, I want to talk just a little bit about transportation, because you may have received some emails as well. And what I do want to say first off with transportation is I want to thank transportation. And they've had some quarantines, they've had some positive cases, and when you're already in an area such as bus drivers, bus aides, bus mechanics, which is an area where we can't fill positions, just as the entire state of Florida, in essence, when it comes to filling bus positions, you're already in a critical area in need of hiring. So when you go down to losing a bus driver, it impacts routes. So now what you've seen in our county, as well as many others, is now they're doubling up routes. So they're doubling up routes. And when they double up routes, now you have some students who are getting home later. So Mr. Horton, Mr. Meyer, Mr. McGinnis, Mr. Jay McGinnis, that is. So we've been meeting on this. As you know, we have the Bus Bulletin app, which notifies families if their student is going to be late. So we've looked at some of the ways that we communicate that, and we can get better. And so we've communicated within our district office of how we can get better with that Bus Bulletin app. So we'll be putting that out here immediately. Also with the way that we communicate with the schools, and then the schools being able to do some call outs as well to help with families. The last thing a parent wants to do is get home and not know where their child is, or get to the bus stop and then where's my child. So like we've said, regardless of the issue, regardless of it, we got to get that fixed. So we've started looking at different communications and making sure that we're looking at that Bus Bulletin app and be as timely as we can with those families. And though there might be, quote, excuses that are in place, those don't matter when someone's waiting on their child. But I want to end on the transportation discussion. You have bus drivers doing 2 routes, 3 routes, more than what they do. You have mechanic secretaries running routes. The work that transportation is doing during this time should be commended. But I will say, in terms of some of our communication, we can be even better. So we're working through that. Just wanted to give you that information. That's all I have.
Okay. Well, thank you, Mr. Chambers, for that informative part of the meeting. So now we'll go down to section 15 and board members' announcements and requests for information. And I'll start with Ms. Gardner this morning.
Okay. I would just like to share that Fort Walton Beach High School is proud to announce their very own Viking Hall of Fame, and it's going to be the next Friday, a week from tomorrow, September the 17th, during the Fort Walton Choctaw game. May have to put a barrier between us two, maybe next Monday night.
Dr. White.
Oh, well, it's 2 against 1, but I got
Well, I'm a
I got
long way
it.
off. I mean, we don't need 4 barriers, or 3.
No. But our very own hometown legends, the highly respected Coach Ernie Green and our Heisman Trophy winner, Danny Warfel, will be inducted
Awesome.
into this, again, our very first Viking Hall of Fame.
2 good ones.
It will be 2 good ones, 2 excellent ones. This is going to be a very special night. If you've ever been to a Fort Walton Choctaw game, it's thrilling. And I say this now because I would recommend getting your tickets now, because I am sure it's going to be a sold-out crowd. And I can tell you Fort Walton Beach High School is coming for you. It's going to be Friday Night Lights at its very best, so.
Dr. Hales, is this when I bring up the record?
Hey, new year.
Yep.
We got it. So, check out those tickets. That's all.
Well, real quick before, I think it's important to remind people that all of our tickets
Yes,
for all high school
online.
games are online through GoFans. So if you come up to the stadium, you know, you might not get in. So make sure you go to gofan.com, I believe it is, and there's an app for it too. So, yep.
And this will be a sold-out crowd. I guarantee
Especially with
you.
those two
Especially with
notables
these two,
being there.
Yes,
Yep.
notables coming in, and they're
Absolutely.
bringing back the 1991 championship team. They're going to honor those, I guess they're adults now, during that halftime presentation
That's great.
also. So it would be a very, very special night.
Yeah, definitely.
Ms. Vincent?
Yes, well, speaking of football, the Baker Gators haven't played yet. They started with an open date. Then the next week, their team canceled because of COVID. They're actually having trouble finding people that want to play them, being the state champions. So they're playing, though, tonight, they're going to be playing tomorrow night, Rocky Bayou Christian Schools at, up there at the Swamp. So looking at that. And speaking of my school, Baker, like to send out some good wishes to their principal, Mr. Martello, who's been ill but is recovering now well and is still at home. Can't make it back to the campus quite yet, but we're excited that he's doing better and is going to be coming back, and did want to do a pat on the back to Victoria Hurley, Jennifer Stewart, Victor Mann, Elizabeth Richards up there, their administrative team. Mr. Martello unfortunately had to go out about going into the second week of school, which is a tough time, always a tough time, but they've done a wonderful job of keeping things going up there at Baker, and I know that Mr. Chambers, your administrative team, has helped them, but that's tough when the top person goes out, but they're doing it, and so Mike Martello, here you go Gators. That's his thing. I wanted to tell the board that something I haven't mentioned about, this board chose me to be the representative for the Value Adjustment Board, which I've actually done since I've been on this board, and I have been attending those meetings. I haven't made many remarks about it because there's not so much that affects us, but I did want to say, if you're not aware of what that board does, is that basically it listens to appeals of those who are not happy with the value assessment of their property. And I have to say that there's not a lot of appeals, that Mr. Busby, the appraiser, does a really good job with that. And a lot of times it's people from out of town who are trying to come here and don't quite know the laws from other states coming in here. And the chairman is Commissioner Trey Goodwin, and they do a great job of handling that. But I have been attending and representing us, and I will say that that board is always asking me and talking favorably about our school board and our school district and all that. Then the other group that I'm with, the Okaloosa Public Schools Foundation, is rolling again. Of course, we have the Take Stock, and that's working with the mentoring. But we just received a $20,000 grant that we want to thank Gulf Power for, because these grants help us to do summer programs and to give teacher grants for a lot of different great projects that we have coming up. We actually are having a fundraiser coming up in September, but I can't invite you because we have already sold out the tickets for this, so we're excited. And again, that funding goes for a lot of projects. All of it goes back into the classroom. But the foundation is doing some wonderful things, and I would like to say, if the superintendent would be open to it, and the board chairman, the representatives from the foundation, I'm sure would love to have an invitation to come to a meeting, a workshop, and give us a short presentation on what they're doing. And I think everyone would be very impressed with the things. And you don't hear about them that much except when I'm talking, but they are doing some wonderful things that ultimately all goes to helping our students in the classroom. So maybe in October or so, as we head down the end of the year, they could come and give an update on what's happening with the foundation.
Well, here's your opportunity to request that.
Well, I kind of am doing that. I was
Yes,
trying
ma'am.
to, kind of, hinting at that invitation. So
That's a great idea.
that would be good. And then finally, just want to say personally, I remember standing in a classroom on 9/11/01 with some English students in amazement of what I was seeing on the television monitor. After a student came running in to tell me what was going on, and certainly anyone in our generation will remember where they were on that day, but something unique about when you're standing in front of a classroom, and I don't care if they're kindergartners or seniors, definitely a time that I will never forget. I remember that happened in midweek, Tuesday, Wednesday, but that Friday we had a pep rally at our school, and it was remarkable how those students responded. So hard to believe it's been 20 years, but it is something that for our generation will be one of those dates that we never forget. And as an educator, I certainly won't forget. So I'm glad that we're doing what we're doing for the district tomorrow. And there are several events going on in our communities on Saturday. Thank you. Appreciate it.
Thank you, Ms. Savanchek. Dr. Kelly?
Oh, okay. Well, I did want to bring up, too, that September is Suicide Prevention and Awareness Month as well. And I know a lot of our schools have stood up Hope Squad clubs in their schools, and I know that they will be available for programs and different things in those schools. So that's a time for us to remember the students and the situations that our students come across in their times, particularly in a stressful time like a pandemic that we're all living in. So just to mention that. And before you even mentioned it, Mr. Chambers, I had on my list to thank two groups of employees, and one is our bus driver staff, who are pulling a lot of loads now, and as you said, doing double routes, and many times in office members there in the transportation department, driving and doing other things that they're not accustomed to doing, as are employees across this district stepping up to take in roles that they normally do not do, and they're doing it without hesitation and without complaining. And the other group is our custodial staff, and we're short-staffed there as well. And both groups, as you said, when they're attacked by COVID and their members are out, it puts strain and stress on the members who are attending and who are able to work, and they too pull double duty and double shifts. And I know oftentimes a whole staff of custodians will be shifted over to another zone, even outside of their zone where they normally work. So thank you to those groups of employees. And I'll end with this. Most of us are not aware, but there is a small window of time every year, and it's just ended, where school board members, through their school board association, may put in for potential legislative and federal platform proposals. And so I did that this year, and I'll just read a portion of it because it's a pretty lengthy form. But what that is, it allows school board members who have a passionate about an issue to fill in this form, which goes to Florida School Board Association's platform committee. And there's a timeline, and they have a committee that vets these proposals, and if they believe it meets the criteria, then they will put this on their legislative platform, and I think it goes through December where they're vetting and looking and reading all of these. And then if it is on their platform, they then can petition for these to actually become legislation. So I'll read you a portion of this, and I'll say in my preface that when this deadline came, I was holding a baby, and I was typing this form in with my little old eyes on my little old phone. So I probably could have done a better job had I been at my real computer. But anyway, this is the crux of the situation, and this is the narrative. What is the current problem this proposal will ultimately solve? So I said, presently, educators across this great state are giving their all to meet all the needs, academic, social, mental, of all their students in the most unexpected, the most unprecedented, and the most unpredictable of times. Whether they serve in the buildings, online, or in another capacity, our teachers are working daily to create an environment of calm amid chaos and continuity amidst upheaval. Often they put their own health and/or the health of their family members at stake just by coming to work. And last year, most did the job without hesitation and without a blink. They did what had to be done for the sakes of our children. They are the true heroes among us. But going into our second year of this pandemic, many have faced a tough decision, that of leaving the profession they sought after and never dreamed of leaving. Some decided to stay and tough it out, some did not. That predicament has left some of our districts with positions still not filled today. Secretaries, bookkeepers, and administrators are covering classrooms. They're not complaining about it. Again, they're doing what has to be done, understanding that everything done on our campuses is in the best interest of students. However, I've been working in education, in Florida, I might add, for more than 40 years now, and cannot even remember the situation being so dire. COVID and its mutations has created an environment of grave concern for many, and our teachers are chief among them. We find ourselves unable to attract the number of new teachers and retain the number of experienced teachers that we were previously able to attract and retain due to these grave concerns brought about by the pandemic. The situation is unique in the educational history of our time, especially in Florida. The brief proposal is that we eliminate merit pay for teachers and principals at least until such time as the greatest health hazards resulting from COVID are eliminated. Senate Bill 736, which did away with teacher tenure and implemented merit pay for teachers and principals, should be repealed or suspended until such time as COVID is behind us, or at least at bay. And I'm paraphrasing now because this is pretty lengthy. We understand that when merit pay was instituted, the ultimate goal was to retain only the best of the best, and that was a worthy goal for that time in our educational history. However, in such a time as we are living now, when it's difficult to recruit and retain those educators, could we not ease the stress of that worry over the performance rating? So the goal then at this phase of our educational history would be to retain more of our current teachers, retention, and attract more new teachers, recruitment, if they were not worried about performance rating during the most critical health scare impacting their profession in recent times. And the only other critical thing that I would emphasize from this whole form is that it asks, would there be a cost savings or a cost incurred? And I put that it could be cost neutral because the funding that was potentially previously used for merit pay could be redistributed to our teachers in their base pay and or in other bonuses to be given to our classroom instructors. And that was it, basically. And we will not know, per the timeline, how far this one gets until about December.
And
That's
Dr.
it.
Kelly and I can kind of elaborate on the vetting process. We actually had a meeting on Tuesday at 11 o'clock, and we had 88 submissions
Proposals.
from across the state. A lot of those are categorized, so other school board members across the state obviously thought the same way you did. We are scheduled to meet on Monday in Kissimmee. Now, I will not be actually there. I'll do it virtual because we do have a school board meeting that night. And then, like you said, come December, we'll bring everything back to the actually, I think it's the end of November when we have our conference, but then that will be the FSBA's legislative platform for the year. So something like that is going to be, it might not be your exact one, but it's going to be
Conglomeration of
conglomeration
those.
of other ones. So I can tell you that this year, the platform that we're really focusing on is try to keep things that are in our lane, basically, which is public education, and try to work with, obviously, we have a Republican House, Republican Senate. Their ideas for public education are obviously the way that they want to go, but we're going to try our best to work, well, we are going to work with all of our representatives and try to come up with something that's going to be something that will help public education instead of maybe getting into the politics of some of the other things that are out there. So I'm really confident that that the platform that comes out is going to be something that all school boards across the state can carry, instead of just having a few school districts, carry that platform for the majority of us. So, but yes, yours was noted on there. So, no. Anything else?
That's all I have.
Thank you for doing that, Dr. Kelly, and
Yeah.
I'm eager to see how far that goes, because it sounds like that is on a lot of people's
Well,
minds.
out of the 88 proposals, I think 2 were actually not even considered because they were more local for that particular
Mhm.
school board. So,
Well, and if you read the form, it says it must be applicable to all districts.
Yeah,
so
right.
Right.
I just felt like we needed to do more for our teachers during the pandemic than we could ever do.
Absolutely. Thank you for that.
Thank you.
thank you. Dr. White?
All right, thank you, Chairman. Just a couple of quick things, because I think we've been here almost a couple hours, and I think, Chairman, you've got about 21 more items to go.
We
So,
do.
Yeah, so just to say that I appreciate the superintendent's rundown regarding patriotic activities in our schools and concerning our founders and concerning the rights that Americans are afforded under the United States Constitution. And I appreciate those lessons and appreciate that occurring in our schools. In my opinion, that's so very, very important.
Yes.
And then the last thing, Mr. Bryan, is when you're ready, I'm prepared to turn it back over to you to go through the rest of those items.
All right. Well, thank you. And I kind of already went through some of my business with Dr. Kelly regarding the Florida School Board Association and the platform. But I, too, would also like to thank the superintendent for putting an emphasis on the Patriotic Day, constitutional, everything that's going on in the schools this month. I do have to say a shout out to my Rotary Club of Crestview. I've been a member of that club for 20 years, and every year we give out constitutions to all of the schools in the North End, from Baker, Laurel Hill, Baker, Laurel Hill, Shoal River, and Davidson. We give them to all the 7th graders, and I believe this year it's going to be about 1,200 constitutions that we're going to give out.
Great.
So I have to give a little shout out to my Rotary Club. And like Dr. White said, we have a lot of public hearing on
Yeah.
Monday night, so I think that's the most I've ever seen in
Yeah.
the 5 years I've been on the board. So we do have a lot going on. So with that, we will move to section 16, public comment, and this will be the 2-minute version of public comment. And so we'll go down to public hearing. We have, not on the, 22 items for public hearings. So, all right, so 17.1 will be the required local effort millage rate of 3.695 mils. 17.2, the basic discretionary operating millage rate of 0.748 mils. 17.3, capital outlay millage rate of 1.500 mils. 17.4, total millage levy of 5.943 mils. 17.5, Resolution 21-05, adopting the millage rates for the fiscal year 2021 through 2022. 17.6, Okaloosa County School District Budget General Fund for the fiscal year 2021 through 2022. 17.7, Okaloosa County School District Budget Special Revenue Funds Food Service for the fiscal year 2021 through 2022. 17.8, Okaloosa County School District Budget Special Revenue Funds Other Federal Programs Fund 420 for the fiscal year 2021 through 2022. 17.9, Okaloosa County School District Budget, Special Revenue Funds, CARES, Elementary and Secondary School Emergency Relief, ESSER Fund 441 for fiscal year 2021 through 2022. 17.10, Okaloosa County School District Budget, Special Revenue Funds, other CARES Act relief, including GEER, Fund 442 for fiscal year 2021 through 2022. 17.11, Okaloosa County School District Budget, Special Revenue Funds, CRRSA, Elementary and Secondary School Emergency Relief Funds, ESSER 2, Fund 443 for fiscal year 2021 through 2022. 17.12, Okaloosa County School District Budget, Debt Service Fund for fiscal year 2021 through 2022. 17.13, Okaloosa County School District Budget, Capital Project Funds for fiscal year 2021 through 2022. 17.14, Okaloosa County School District Budget for fiscal year 2021 through 2022. 17.15, Resolution 21-06, adopting the Okaloosa County School Board District Budget for the fiscal year 2021 through 2022. 17.16, public hearing for adoption of revised school board policy, Chapter 1, Governance and Operations.
I do have one question.
Yes, ma'am.
I believe that was the one that identified the Sunshine State standards as our operating standards. Should we add the best standards in there? Just a note. It can be looked at later, but just a note to
It
consider.
should be.
It was not in there, but I thought it should. Thank you.
Thank you, Dr. Kelly. 17.17, public hearing for adoption of revised school board policy, Chapter 2, Fiscal Management. 17.18, public hearing for adoption of revised school board policy, Chapter 3, Instructional Matters. 17.19, public hearing for adoption of revised school board policy, Chapter 4, Students. 17.20, public hearing for adoption of a new job description for Technician Safety Security Management. 17.21, public hearing for adoption of new job description for Director 1, Student Intervention Services. 17.22, public hearing for adoption of revised job description for Director, Exceptional Student Education and Student Intervention Services. And before we adjourn, I just want to make sure that the public knows that a lot of the first items on public hearing, we're dealing with taxes and all, and I'm happy to say that there's no tax increases
For 31 years.
for 31 years. So with that, so we'll go around the room. Ms. Appleberg, anything?
Good morning, everybody. I want to just start off by saying, talking about the COVID numbers and talking about all the different protocols and everything that are being in place, I want to acknowledge that the school district sees that the numbers are increasing and that we need to do something for it. So what I'm about to say is nothing against the school district. It has, that's not geared towards the school district, but you guys deserve to know, and our public kind of deserves to know. So as you know, we get all of our numbers from the Department of Health. Mr. Chambers has mentioned that multiple times. I get emails almost daily from teachers. I can't speak about student numbers, but I can speak about faculty numbers. They're not up to date. They're not true numbers from what we're seeing. We have schools that are saying that there's 0 cases for staff, and you have, 5 staff that are currently out and they're positive. These things are happening. They're happening because we didn't have any testing sites. I can speak for myself. I couldn't get tested anywhere. I had to end up going to Andalusia to get tested. Well, I called the health department after that and told them that I was positive, but because I tested out of county, it didn't count for our school district. But I got it there. That's where it's from. And so you guys just kind of need to know that it's not accurate. And for the people that are working in the schools and are like practically killing themselves trying to cover for other teachers, you have teachers that are making lesson plans for teachers. They're making newsletters. Even for the first day of school, there were some schools that had teachers out because of pre-planning. And they're creating, their open house packets, their newsletters, everything that they need to do for themselves and then those that are out. And so when you see those numbers and it says that there's 0 or there's 2, and I can name 10 off the top of my head at certain schools, that's hard. And as you know, we have members and we have instructional staff and just staff in general that have been in the hospital. They've been on oxygen. we have that happening. We have some that are still not able to come back. They're negative now, but they're still in oxygen tanks at home. And so when you see those numbers, it's very discouraging when it comes to educators and to everybody that's on the school side to see that and to see that, it's not really being accurately reported out there. And like I said, it's nothing to do with the school district. That's nothing, this is nothing out there about that, but you deserve to kind of know that that's kind of the feeling that's going on. It's very discouraging for those that are behind, the lines, they say. It's very discouraging when you see that, and when you get the new COVID numbers out there, they're still not accurate.
Well, I have a question, Jerry.
Yes, sir.
And are you finished, or you
No,
want me
I'm
to
fine.
wait? Is it
Go
okay?
ahead.
All right. So when you say these numbers are not accurate, I know every evening I try to watch usually WEAR,
Mhm.
Channel 3, and are those numbers inaccurate too for these other counties?
Other counties are not seeing from talking to other presidents around the area for the union, from my understanding, there's still discrepancies in theirs, but nowhere near as big as what we're having in Okaloosa. From what I've gathered. Now, that's just talking to other presidents. Obviously, I don't know exactly for sure, but I do know that there are some discrepancies, but nothing as huge as what we're having in Okaloosa. Mind you, like Escambia County, they have the drive-through clinics.
Mhm.
It's very easy to get tested in Escambia County, so their numbers are more accurate versus people here having to get at-home tests because they're trying to not infect anybody, so they need to know if they're positive, but then it's just not working out that way.
And I don't even know if the health department accepts at-home tests.
They do now, but you have to have, it's an app, if I'm correct. It's an app now that you have to do.
Hold on. So, real quick, thank you, Ms. Appleberg, for bringing that up. But I will tell you that I actually asked Mr. Chambers about this because I had heard across the board. And Mr. Chambers, would you please care to elaborate on what you told me on why what they might be seeing in real time is not what is on that dashboard?
No, absolutely. So, first of all, I want to also acknowledge exactly what Ms. Appleberg just said, because you do have employees who are going well over, above and beyond during this time. So what we get each day is a list of positive cases from the health department. That's what we get, and that's what we go by. What we also know is you could have someone who took a home test, and unless that person notifies the school of the home test positive, and then the principal knows if they're notified, then we also then notify the health department. The health department then puts that on the spreadsheet, and then that gets notified to the district and then back to the school. But if home tests do not get reported, then there is a discrepancy. Also, just like we've shared with principals, and they'll be getting this information out as well, and I do want to put the caveat out there because I feel Jordan's frustration, and I'll just go a little bit there for a second. The school district has become a health department. So I just want us all to understand that. That's what the school district has become.
Well, obviously, if we have a COVID administrator now in the schools.
So on the home tests, there's a list of home tests that will accept a positive. So all the home tests will say whether you're positive. Then there's one, a Lume, that is a positive and a negative. And then the Lume negative will allow you to come back. Okay? Also, on the home tests, like Ms. Appleberg was talking about, if you do not do the instructions verbatim that might be on the third page within the small print document, then the health department will not accept the positive case. So when you spend $65, $95, $105 on a test that you know you're positive, but you didn't follow the directions and then it's not accepted, then how many of those individuals are now going to go back and pay another $65, $95, $105 to do it the quote right way and then have those numbers there. Now, this is not just an Okaloosa County thing. Health departments here in Okaloosa County, health departments in our surrounding areas and in other parts of the state, they're also backlogged. So we know, for example, at the beginning of the year, we had a particular high school where we were showing 2 cases. We knew that there were 12 cases or 13 cases amongst employees. The thing that I want the board to know and the public to know, so we didn't just sit there and go, okay, there's a 9 discrepancy, and we're just going, we're doing nothing, so we're still taking action in those areas. But there absolutely is a backlog in numbers. So what we also know is we may find out today that we have 2 employees that are positive or 3 students that are positive, and then tomorrow they're not going to make their way on the spreadsheet because it has to come from the Department of Health. But 3 or 4 days later, they end up making their way to the spreadsheet. The difficulty that wasn't here last year are these home tests. There's a list of them. And then even the antigen tests, I'm getting a little riled up right now. And then the antigen tests that all of a sudden pop up at one of the pharmacies that the health department didn't even know was there. And that's not a negative to the health department at all, because the health department's been great communicating with us. But all of a sudden, these antigen tests then also pop up. Well, now when a pharmacy says you can come back with this antigen test, but that's not what has been communicated to the school district, now you have parents who are now upset because someone said they can come back, but that's not what was communicated to the school district from state officials. So I go back to thanking Ms. Appleberg and the teachers and the employees, because of what they're doing right now is nothing that's been seen, I would argue, in public education in a whole long time. Things are changing daily, and then the schools have the brunt of implementing those changes. And then we all have the responsibility of answering to the public when there's confusion, and I understand why. We've had multiple principal meetings / assistant principal meetings. I had the front office secretaries who answer phone calls on a Zoom yesterday, so we can make sure that we're all on the same page in terms of information that goes out to families. Because what one school says and another school say can be different. The amount of scenarios of when a student can come back, or the amount of scenarios for these tests, are massive.
Yes.
Are massive. So continue to get the information out there and communicate with our schools is something that we have diligently done, but it's still hard with the information. And what Jordan says, I don't disagree with, in terms of we are, and I use the word mercy, so probably not the right word, we're at the mercy of the data that comes to us. But on the data that comes to us, we act. And if we also know that there's something inaccurate where someone's positive, we still act on that.
Right. And real quick, Jordan, so on that COVID dashboard, if you look at the very bottom, it says this information is coming directly from the Department of Health.
Correct.
And why is it that we're just relying on the Department of Health and not necessarily taking information from the schools?
Well, one, it's supposed to come from the Department of Health.
Right.
Last year, if you remember, it came from the State Department of Health is where we got that information. That's no longer available. This year, we wanted to work with the Department of Health, which is what you're supposed to do, but also for complete transparency, there's the school district trying to get your numbers, and we're not set up as an organization when these numbers are fluctuating as they do to compile all that information. So we get that information from the Department of Health, download those numbers, get it in our spreadsheets, and then get those numbers out as efficiently as possible.
Right. And like you said, the Department of Health is behind, way behind.
They are.
Yeah.
Well, and just to add, they really are
Yeah.
the health experts.
Right.
Even though we're
Exactly.
having to assume that role.
Right.
I mean, in my opinion, it makes sense to depend on the Department of Health, because that's their job, that's their task, that's what they're mandated and charged to do. But I understand the difference.
Which is
Yes.
exactly why I wanted to point out at the very beginning that it was nothing against the district itself,
Right.
because the district is doing what they're supposed to be doing. They are following Department of Health's numbers. But as board members who represent everyone in the school district, and employees included, you guys, you need to know, because I do. I just sitting here in this meeting, I've gotten 4 emails from teachers about the fact that the numbers, because they just came out yesterday, that they're not accurate, and how frustrating, and how that just kind of gets the morale
Well, in fairness,
down.
they are accurate to the information that we have.
They're
but-
accurate to the information that the health department is releasing.
Well, and exactly,
Yes.
but like Mr. Chambers said, I mean, we are reacting when we do hear a positive test, so.
Yes, and that's why I wanted to say,
Right.
like, and our principals, you mentioned the COVID administrators.
Right.
I mean, it's nothing against the principals. I had a meeting while I was sick on Zoom with Mr. Chambers, and even then I told him, principals they're trying, they're doing the best that they can. You know, I know that I speak for teachers and that's supposed to be my job, but, I mean, the principals, they're staying at their schools, they're working all weekend trying to do contact tracing. We really have become an extension of the Department of Health. But I know that these things are out there, and I know that if you're on Facebook and you see different things, and some of you know that there is that Facebook group that does anonymous reporting and things like that, it is coming out there that the numbers are not accurate. But I needed to voice that to you guys to let you know that the frustration that's coming from the instructional side when you're doing everything you can and it's just not being acknowledged in that way. It's being acknowledged by the district, but it's just not being acknowledged and probably not validated.
Right.
Validated is probably the better word of that. But I just wanted to make sure that I let you guys know.
Well, and it was very much appreciated because I think this conversation kind of helps dispel the fact that we're not being transparent, that we are being as transparent as the information we get. On that dashboard, according to the Department of Health, like Dr. White said, you know, that's their authority.
And I believe, and correct me if I'm wrong, Mr. Horton, I think even on our dashboard, we put the caveat out there, that there's a caveat statement that is on there about the numbers. So it's what we get at the time that we get it.
So, Dr. White, where does Channel 3 get those numbers?
I'm not sure, Ms. Van Check. It may come from the district websites.
I
Okay,
think off the dashboard.
okay, they pull them off that, because I've heard them say before that Okaloosa didn't report.
Right.
They have said that
No,
multiple
they're-
times, but I
they're-
think it's
what
just
they
not an
say is that-
updated piece.
What they
the
say
most
is that
current.
we are not reporting everything that other districts may be reporting.
Okay,
And our district is more transparent than some others across the state because you have some districts that don't even break it down by school.
but that sounds like we're not giving them the information, so.
Well, somehow they're getting the information. I don't know if we actually provide it. I see Mr. Horton moving his chair back.
Thanks, Dr. White. So, 2 things. Last night, as I watched the news, they did give a report of Okaloosa's positive cases at the 5:30 Channel 3 News.
Yep.
But what's happened, I think, is, again, differences in the way counties report. We report not only cumulative total positive cases from the beginning of the school year, but also a daily count. And so when we report that there were 40 cases in a given day, then that's how many positive identified cases we received from the Department of Health that day. I think what's happening in the other districts, maybe based on what I can extrapolate, is they're giving a positive number on a given day, and it reflects every person who is positive at that moment. So where you might see that Santa Rosa County's got 300 or 500 positive, well, there's some folks that were positive the first 2 weeks of the year and they're no longer positive. There were some folks that became positive 5 days ago, they're still positive. And so I believe that the count they're giving is a running total at that moment in time. And so I think Channel 3, to their credit, it's hard for them to compare apples and oranges in the 10-second soundbite, but they did say yesterday that our cases were, I think, because we reported through the weekend and gathered those, it was 120 some odd cases. But I think it's because it's not absolutely apples to apples across the board, it makes it more difficult to interpret. But
But you're not providing them that information.
no,
are
they're
you?
going to the website and
Right.
getting it, and I've had conversations with the media outlets about, here's the information we have provided, it's available to you, let me know if you have any questions, so we've answered those, and we did get some, and they were asking, is this a total for the day? And so I describe how we come up with that number each day from the Department of Health. So I think that's one of the things.
Thank you.
Thank you.
Thank you, Ms. Appleberg. And we'll go around the room still. Dr. Hale? Ms. Lightbourne? Mr. Horton, anything else you'd like to add, sir? Ms. Perry? All right, this meeting's adjourned.